Alright, so Karma's come in here today to get her teeth cleaned. The first thing that we're going to do is do an assessment of the tooth itself. Now if you can see here, we've got some discoloration along this area here. That's tartar. So we're going to do a measurement of how much tartar or calculus that we see on her tooth. And at this stage we're looking at covers roughly just around 50% of the tooth surface. This is what we need to remove to ensure the health of this tooth. The next thing we do is that we take a measurement of the sulcus, which is just below the gum line. So if you can see on my probe there, we've got some indicators. Those little marks there indicate millimetre measurements. And in a dog, we should be getting normal measurements of between 0 and 3 millimetres. And then we know that we have a healthy sulcus and a healthy tooth. We have no pockets of infection there. And that's how we assess a tooth. The next thing that we do also is we check for the amount of gingivitis. You can see here that a gum is quite inflamed when we press on there, and that shows that we've got some gingivitis, as well as when I do that little bit of probing, we do get a tiny amount of bleeding happening at that gum line edge. The last thing that we do is that we check for mobility. And mobility is we want to see if that tooth is loose or if there's any movement there at all. And Karma's canine tooth there is quite solid, it's quite healthy. So the next thing we'll do is we'll clean that tooth up. Okay, now the next step in Karma's dental treatment today is that we're going to clean the tooth surface. So we're going to remove all of this discoloration that you can see on the tooth there, which is the tartar or the calculus built up, as well as remove all the plaque. And we're not only going to clean the tooth surface here, but we're actually going to go below the gum line and we're going to clean that sulcus depth out there as well, just to make sure that we've got a nice healthy tooth. It's good and clean, and it's also clean underneath the gum line. Now this instrument that you can see here in my hand is an ultrasonic cleaner. This is the same as what your dentist uses for you to clean your teeth when you go in for a scale and polish. The way it works on cavitation, so it's like a little tiny jackhammer working away on the tartar that's built up, that's as hard as concrete. Now when I start this up, it'll have a little bit of noise, so I'll run this through and we'll clean up Karma's tooth. So as you can see there, it's a relatively quick process to remove that tartar that's built up on the tooth there. However, it does take us quite a considerable amount of time because the tooth has 4 surfaces complete, and we clean all 4 surfaces and the full size of the tooth. So this process takes just a little bit longer than what your dentist does, because your dentist just cleans up the small areas that you miss with your toothbrush, whereas we clean the whole of the tooth surface as well as below the gum line. Okay, now the last step in the process for cleaning Karma's teeth is, now that we've removed all the tartar and plaque that's built up on the tooth, the surface is left a little bit rough, which means that plaque and tartar can build up on it much more easily than if we have a nice smooth surface. So to make sure that we give her a nice smooth surface on those teeth now, we use some paste, and this is called a prophy cup or a polishing cup. This will oscillate, so this will spin around on the tooth, laying down the layer of paste, and it'll polish the tooth and leave a nice smooth surface. That's going to make it so much harder for the plaque and tartar to build up on the tooth surface the next time round, because we want to maintain this clean tooth for as long as possible. However though, this tooth will be completely covered in plaque within 36 hours, so it's really important that we get you doing some toothbrushing or something at home with Karma or your pet when they come in for a dental prophy. So when this little instrument starts up, there's a little bit of noise again, so I'll stop talking and I'll polish Karma's tooth. Okay, and it's as simple and easy as that. So we've now got a nice smooth tooth that's been polished. We'll give it a quick rinse with some water, so when she wakes up she doesn't taste nothing but that paste in her mouth. So just a little bit of water there. And now that you can see, we've got a perfectly clean tooth. We've removed all signs of plaque and tartar, and she's got a lovely smooth finish to that tooth.